This episode of the Police One podcast is sponsored by Officer Store. Learn more about getting the gear you need at prices you can afford by visiting officerstore.com. Hey, welcome back to Policing Matters on policeone.com. I am your host, Jim Dudley, and you're listening on the podcast, or maybe you're watching right here on the YouTube channel where you can see my guest and unfortunately get to see me as well. Well, many would agree that drug addiction is a public health problem. We've seen iterations of how to deal with it, ranging from the harm reduction model of permissiveness to using other drugs to combat the effects and enhance rehabilitation. But are they working? We've seen overdose deaths climb over the past 2 decades from 10,000 to over 100,000 annually. Those are numbers we may expect from a war. Should we engage the problem as such? Is it time to start a new war on drugs? Well, my guest today is retired DEA agent Mike Brown. Michael W. Brown has a distinguished career spanning more than 32 years as a special agent for the DEA, the Drug Enforcement Administration. Most recently, he was the DEA headquarters staff coordinator of the Office of Foreign Operations for the Middle East, Europe, Afghanistan, India. Prior to that, he served as the country attaché in India and Myanmar, providing foreign advisory support for the counter-narcotic enforcement. He's also served as 10 years in Pakistan as a special advisor to the U.S. Embassy on various law enforcement issues. Michael is a graduate of the United States Ranger Training Battalion and has a master's degree in interdisciplinary technology and management from the University of Eastern Michigan. Mike is the global director of counter-narcotics technology at Rigaku Analytical Devices. Did I say that right, Mike?
That's a good one. Rigaku, pretty close.
Rigaku. Okay. Well, hey, welcome to Policing Matters, Mike Brown. Hey, thank you for your service and thank you for all the years dedicated fighting drugs with the DEA.
Thank you. Thank you for the invitation.
So you heard my introduction. Our current efforts, if we want to call them that, in combating drug deaths, is it anywhere near working anywhere in America?
In terms of, we're talking about fentanyl, right? The DEA recently identified that roughly 7 or 8 out of 10 pills contains a deadly dosage of fentanyl that can kill an individual within seconds. So this is the first time we've seen a narcotic of this power and this magnitude. In terms of what's working, certainly U.S. law enforcement, DEA, CBP, state and local, they're making seizures of fentanyl. They're making the investigations. They're convicting organized crime members, but they're not. We cannot address the mechanism of production in Mexico and the precursor chemicals. So in terms of making an impact, yes, every pill taken off the street is a potential life saved, but we're not making progress in saving the next life. We're doing the same thing every day, expecting different results without going to the source of the problem.
Yeah, we know what we call that, right? So the fentanyl chain, you mention it, and we have porous borders to the north, south, and pretty much however you want to get into America. Chemicals are being brought in from foreign nations, sometimes through the porous borders, but sometimes right across our shipping lanes. What are we doing to stop those chemical imports that are directly being used to make fentanyl and other drugs?
Well, here's really the original, what I call center of gravity. We're talking about the precursor chemical supply chain, which has been in operation for over 40 years, supplying chemicals to Central and South America to make cocaine, methamphetamine, and heroin. Now, of course, we're seeing those chemicals to make fentanyl, right? So once those chemicals are acquired, they're shipped from China, sometimes India, to Mexico, where they're shipped to clandestine laboratories. Fentanyl is produced and then smuggled in bulk quantities across the U.S. border primarily hidden in vehicles and cargo. So really, it's coming across the official checkpoints. The issue is the number of traffic that comes across the border, right? How many cars a day come across all the checkpoints with Mexico and the United States? Tens of thousands of vehicles. Literally, it's the needle in the haystack when you're talking about identifying which vehicle, which cargo containment may have 100 million pills, a billion pills hidden in it.
Yeah, and so we talk about the illegal or the illicit drugs, but we're fighting our own battle here at home too with over-the-counter or prescription drugs. Are we talking about two separate battles when we talk about prescription drugs and the illegal drugs?
Well, absolutely. The prescription drug issue, especially with Oxycontin and Purdue Pharma, launched us into the fentanyl epidemic, right? It went from Oxycontin to heroin, and the users went to fentanyl. So it created a door for the Mexican cartels to create a huge opportunity, which they took advantage of. And now they are the primary producers of fentanyl coming into the United States. They are even setting up fentanyl labs within the US because if you're a business, if you can move the chemicals and production closer to your distribution chain, you're going to make more money and you're going to reduce your seizures at the border. So fentanyl has been such a huge success for the cartels and domestic trafficking groups that now we see it taking over other distribution chains such as methamphetamine and heroin.
Yeah, and fentanyl started out with a legitimate purpose, legitimate as far as a painkiller similar to OxyContin and the Purdue Pharma. But what sent it spiraling out of control to where it's such a threat on the streets today?
Well, I think we have to make a distinction. When we talk about fentanyl, people think it's a Schedule II controlled substance. We're talking about, excuse me, fentanyl patches or injections used in oncology or by doctors to treat severe pain. Right now, there are thousands of Americans on fentanyl patches that's saving them from severe pain, and none of them are dying from overdoses. Now we're talking about Mexican cartel fentanyl. I think there needs to be a separate classification for cartel fentanyl as a Schedule I controlled substance because it's different than medical grade fentanyl. And of course, fentanyl is very potent, right? It's 100 times more powerful than heroin, 50 times more powerful. I'm sorry, 100 times more powerful than morphine, 10 times more powerful than heroin. So for the user, for the individual caught in substance addiction, fentanyl provides a better high, basically.
Yeah, better high. That's a tough one. I've had students come up to me after class and say, we're talking about drugs in class, but what you don't say is the reason why people are doing them. And I don't think we want to advertise the fact that they're saying it's the best high they've ever gotten. So much so, it's so attractive that you've got people living in the streets in squalor, in horrific medical conditions, uh, just bending down literally to this drug.
When we talk about fentanyl, it draws you in the illusion of the better high. But then once you're addicted, it becomes about not going through withdrawal, right? The withdrawal from any drug, especially heroin and fentanyl, is very, very difficult. So the user, once hooked, now he's thinking about, I don't want to go through withdrawal. So I have to continue to use the narcotic, which pulls them deeper into the psychological and mental addiction to the drug, which also has the physical addiction, making it virtually impossible to get off of it on their own.
Yeah, getting off of it voluntarily. Haven't heard much of that happening. Here in California, we lost the ability to leverage people into rehab. We're walking that fine line between criminal behavior and physical drug addiction. And clearly, we'd love to get people off the drug and back to being a participant in society. But really, we have no hammer. Is that what you're seeing nationwide? That there's no way to compel people into treatment these days?
Well, this is a particular problem, and I hate to get into the politics, but it's hard to avoid. When we talk about sanctuary cities and their policies, right? We know that drug addiction is a form of mental disease, which means if you have a drug addiction and if you have a mental condition, there is some level of diminished capacity. in which the individual is no longer in a position to make those healthy choices for him or herself. That's when I believe the state has a responsibility to step in and say, okay, this person has diminished capacity. They are a serious substance abuser. They have an addiction level that's going to require assistance. And if you're arrested, you don't go to jail, but you have to go into rehabilitative services. I think there has to be some level. We have to recognize that with the mental illness is increasing on within the homeless population, is directly linked in a large percentage to fentanyl, heroin, and methamphetamine, and that the state now has a responsibility to do due diligence to save lives instead of enabling users to continue dangerous drug pattern behaviors, which result in the overdose fatalities.
Yeah, absolutely. I'm 100% with you there. We've seen, the mental illness factor when people are on the streets, they're not taking their prescribed meds for the mental illness, and so they're self-medicating with street drugs. Just makes for a horrible situation on the street.
Absolutely. And if you look at Philadelphia, if you talk about xylazine, which is a animal tranquilizer that the traffickers are now mixing with fentanyl, it causes severe necrosis. Now, I had an opportunity to go to Kensington in Philadelphia and walk around with some of the harm reduction groups, and literally they're treating people with open wounds around their injection sites, which you could die from secondary infection. But when offered treatment, they rejected treatment and they said, look, I got to get to the next high. I need to get my fentanyl, my heroin. I don't want to go to the hospital. Just patch me up. That to me is diminished capacity. That's an individual that now should be removed from that situation, put into a hospital, and then giving treatment.
Yeah, and when it comes down to the ability for a law officer on the street to force someone off the street, maybe through a mental health detention, danger to self, danger to others, or gravely disabled, you get them down to the psych clinic and they turn around and send them right back at the door saying that they are none of those. So cops on the street are really put into a tough situation.
Yeah, I mean, you were in law enforcement. I was in law enforcement. There was no harm reduction training class at the DEA Academy. We're not trained to do that. That's not our responsibility. But I know a lot of cities are now sending out mental health workers with the police to do an assessment and try and make that situation resolve more safely. Because if you're an officer, you get into a situation, a mental health issue, maybe you have to shoot that individual. We don't want that to happen. So we have to have mental health professionals on the street with officers. But then what do we do with those individuals, right? We do not have a systematic procedure for managing those individuals suffering from severe mental health in which they can receive treatment.
Yeah. So you mentioned a little bit about the gang influence from Mexico, the supplies coming in from China, new gangs forming in the US. Tell us about that.
Well, not really new gangs, but increasing in old gangs, right? MS-13 have seen their numbers surge with the open border situation. Tren de la Agua, which was recently involved in the shooting of the two police officers in New York City. Then recently they assaulted two officers some months before. So Tren de la Agua is increasing their numbers in the U.S. by simply sending their soldiers across the open borders, where they're going to New York, where they're going to California, large major urban cities, and they're linking up with MS-13. Now, of course, MS-13 is associated with the Gulf Cartel, the Jalisco New Generation Cartel, the Mexican Mafia, and Sinaloa. So what you have is a force multiplier between Tren de la Agua and MS-13, setting up distribution networks, murder for hire, extortion, human trafficking, sex trafficking, and random violence on the street. It is a recipe for complete chaos in our major cities.
Yeah, so what do we do? How do we interdict the cartel's money supply chain to degrade their ability to sell fentanyl in the US? They can't operate without the cash.
When we talk about the organizational structure of these cartels, we're talking about trying to take down a corporation like Google and Microsoft combined, right? These are major international organizations that are relying primarily on Chinese money launderers who are using what they call mirror remittances and cryptocurrency to move hundreds of millions of dollars from drug distribution locations in the US back to Mexico. We would need an army of agents working the internet, the dark web, 24 hours a day to even begin to impact the flow of that currency. We simply don't have the manpower and technology to keep up with the fast pace, or what I call the evolution of narco trafficking.
Yeah, that is a tough one when you put it like that. So I've heard you talk about the three strategies to disrupt the cartels. What are those?
Well, cartels have what I call basically five critical pillars of capability, things they need to function. One is the ability to order precursor chemicals from China or India. Second is the ability to transport those chemicals from point of origin to clandestine laboratories in Mexico or Central and South America. The next critical capability is smuggling it across the border in bulk in which they can make a profit. The last and perhaps most critical capability is the ability to collect those resources, those profits, launder them, and send them back to Mexico. To successfully mitigate the fentanyl situation, U.S. law enforcement or the international community have to take out at least two of those critical pillars, or we really are not doing much of anything to arrest the problem.
Yeah, that makes complete sense because what is the obligation of the other country when they're happy that these guys are leaving and heading up to America to do their dirty work?
And this is the most critical point. I worked overseas for 25 years, embassies all over the world. DEA relies heavily on their successful bilateral relationships, as does the State Department. And that relationship with China and the PRC is probably the worst it's ever been. Mexico, just as bad. So at the bilateral level, we are not getting successful cooperation with the source of the precursor chemicals or where the fentanyl is produced and transshipped into the United States. If you don't have that bilateral relationship in place, there's nothing U.S. law enforcement can do because DEA, our authority stops at the U.S. border. That Constitution keeps getting in the way, you could say. So until we can address the bilateral issues, there's no way to reduce the flow of those chemicals coming into Mexico. Mexico has a new president, the first female president in their history. We're waiting to see what she's going to do. But is she really going to go up against the cartels her first year in office? Vintez Fox tried that. It ended his career. So I don't think we're going to get a lot of assistance from Mexico. It's going to be up to the United States to come up with a strategy that's going to mitigate that fentanyl threat.
Yeah, I hear you. I mean, shortly before the election, you had candidates shot, kidnapped by the cartels. It's a tough situation there.
Yeah, without question, Mexico has been in a tough situation. But like Colombia, they formed relationships with these cartels many years ago, thinking they could manage that relationship. And what Pablo Escobar showed us, the Medellin cartel, is they're going to want to take it all at some point. And that's where Mexico is at this point. They've been working with those cartels at various levels for too many years. You just can't turn them off. Now they want it all. And that's why Mexico is in a state, excuse me, they're literally in a civil war with five different cartels at the same time.
Wow. Wow. Well, those are big problems. And I want to talk with you about solutions if there are any from our end. But first, I'd like to take a moment and thank our sponsor, Officer Store, equipping protectors with passion. That's how we operate, and it's how we live. We understand that having the right gear can mean the difference between life and death. Our goal is to get you the gear you need, when you need it, at prices you can afford. Visit us at officerstore.com. And we're back, and I'm speaking with DEA agent Mike Brown, 32 years of service. Boy, you've seen it all, Mike, with why inner city violence related to illicit fentanyl distribution. Why will it be increasing across the U.S.? I mean, are we going to start to see Americans team up with these cartels in America?
Well, one of the biggest problems is we have domestic criminal organizations. Right? We mentioned Tren de la Agua, MS-13. All the major cartels are set up here. You have the Crips, the Bloods. You have hundreds of organized criminal groups working with the cartels to sell narcotics, human trafficking, sex trafficking, etc. The problem is we're seeing in a lot of, again, we're back to sanctuary cities. We're seeing the breakdown in the rule of law. No cash bail. You can get caught with fentanyl and released the next day. Criminals are being arrested, repeat offenders, and they're being put back on the street. So in an era where they're trying to reduce the penalties for crime, we're seeing an influx of drugs. The cartels understand this. They sit back, they have their analysts, just like we do in law enforcement, and they say, you know what? Let's send more fentanyl to New York, to Chicago, to San Francisco, to LA, because no one's getting arrested. Colorado passed bill, I think it was 110 in 2020, which basically decriminalized personal use of narcotics to include fentanyl initially. They've since pulled that bill back because it increased their overdose deaths, their crime. It became a narcotics tourism location, right? So these, what I call progressive harm reduction policies, are not working, but new states such as Rhode Island are trying to initiate them. This is definitely a move in the wrong direction, which the cartels will simply continue to exploit. And then domestic trafficking groups will then begin to fight each other for the increased territory for distribution. Nobody wants to just stay on their block. Fentanyl is such a moneymaker, it's now encouraging gangs to move on other gangs to take their territory. And of course, civilians like you and I are going to be caught in the middle of that war.
Yeah, absolutely. And I believe Oregon as well in 2020 enacted Prop 110 to essentially legalize drugs. I think there was $100 fine if they were caught using them in public. But we've seen the degrading there, the chaos, and they too, just at the beginning of this year, pulled back on the out and out legalization. I mean, it's tough when, I don't really like to get into politics either, but it really does come back to the politics. It does come back to, the soft on crime approach. We've seen gangs mitigate harm to their organizations by skirting the issues. They know where they can get away with it. They know that most states have really lax laws when it comes to juveniles, so they've used juveniles to be mules or to distribute or hand off drugs or money. So it's going to have to come down to the legislators, isn't it?
Well, I think right now, I mean, we understand the cartels are bad guys. We understand domestic trafficking groups are bad guys. What we've used in the past to counter that are progressive law enforcement policies. Those policies are being destroyed, creating an opportunity for criminal networks to exploit soft on crime or really no crime at all policies, right? I mean, Mayor Wu in Boston, she wants to get rid of shoplifting and theft altogether. She wants to get rid of the gang registry list. I mean, I can't imagine criminals are going to go to Boston overnight and every CVS and Walgreens is going to be closed down within a week. And of course, that's going to have an economic impact on your inner city communities, jobs, education, healthcare will be affected. I don't understand the mindset of some of these mayors who are going down, who want to basically remove all law enforcement and somehow think magically that criminal organizations are not going to be criminal anymore.
Yeah, and we're hearing it from other communities as well. We've got, public health weighing in saying, hey, we're going to do what we can because it's a public health issue. We're going to use harm reduction and mitigation tactics to bring it down. But at the beginning of the show, we talked about the over 100,000 deaths of overdose in America. I mean, it's an issue for me because right here in California, in San Francisco, my city that is smaller than, or excuse me, it has a population of 800,000. So it's close to probably 5 or 6 state populations. But the number of overdose deaths of 800, the per capita population affected is much worse than many of these states. We're protecting the homeland from fentanyl by attacking the points of supply. Is that really possible?
Well, you can't do two things at one time. You cannot continue or successfully have prevention mitigation strategies when you have you have 100 people being addicted today, you're only being able to treat 1 or 2, right? With the amount of fentanyl coming in, the cartels are oversupplying fentanyl, which is now driving addiction. There's so much out there now, and it's so cheap that everybody's getting into it. So there's no way to treat people successfully. And a real harm reduction drug treatment program takes about 5 to 6 years. And then you have to have post-care treatment. So you're talking a very long time per person. So unless we deal with the supply and reduce the amount coming into the country, there's no way to effectively treat people before new people become infected, so to speak. Like with COVID, look at all the things we did with COVID to reduce the infection rate while we treated people to get them better. So the government was very quick to tell you couldn't go to work. You had to stand 6 feet apart. You had to wear a mask. You had to do all these things. But then when it comes to 100,000 people a year dying from fentanyl, the government's quiet.
Yeah, I hear you. Hey, so thinking about speed manufacturing domestically, right? So our local speeders are going to CVS, any Rite Aid, Walgreens, wherever, buying up the really good Sudafed, taking it home, crunching it up, and making their own batch of speed. Yeah. So we come up with a registry. We come up with a process that says when you buy the good stuff, not the over the counter stuff, but the stuff behind the counter, that you've got to present your ID. I guess that's somewhat affected the homegrown market of making speed, but now I don't know the chemicals involved in fentanyl. I sure don't want to advertise them here on this show, but why is it that we can't restrict the independent chemicals? Are they just too localized? Are they just too common for other uses?
Well, you're talking about methamphetamine, which was huge in the 80s and 90s with the bikers. Pseudoephedrine was the primary precursor to make methamphetamine. So people would go into the store, CVS, what have you, and buy all up the pseudoephedrine strips, take them and then process it. But those were small, what we call kitchen labs, right? So we said if we can control the precursors, we can reduce the ability of these small labs to produce methamphetamine, which is exactly what happened. Then it all shifted to Mexico. Mexico says, hey, we can get the precursors from China. And now Mexico is one of the largest producers of methamphetamine in the world next to Myanmar. The key is we cannot control, we meaning the United States, cannot control the flow of precursors required for fentanyl. They're not produced. What's produced in the United States is highly regulated. It'd be very difficult to buy it in bulk. So what the cartels are doing, they're simply going to China and they're ordering it online. And the PRC knows this. They're actually giving rebates to companies who sell the most, long as you don't sell it domestically. And here's the thing people don't realize. China doesn't have a fentanyl addiction problem because China says, the PRC says, you can't sell it. Don't get caught selling it in China. They have a death penalty, right? They execute 300 to 400 people a year for narcotics trafficking, but nobody's been executed for fentanyl. This should tell you something. So we have a state government which is indirectly or directly sponsoring, supporting companies selling precursors to cartels, which they know will kill 100,000 Americans a year. That's really the problem.
Yeah, so China and Mexico, ironically, both have pretty strict drug laws in their country.
Absolutely, they have strict drug laws, but as the former president of Mexico said, they don't produce fentanyl. He says the drug problem is an American problem. Parents don't love their kids, and that's what we're dealing with. We're dealing with denial. We're dealing with corruption. We're dealing with cartels who are embedded in foreign governments who are basically running those countries in some aspects.
So, I'm totally being respectful of your time. I appreciate all you've said and the information given to us today. I want to ask for the street level cop dealing with fentanyl and unidentified powders. What can be done to manage the fentanyl risks faced by law enforcement officers?
Well, this is where technology can play a really significant part. When I was an agent, if we seized some heroin or I bought some drugs undercover, I'd simply open up the bag, you take my knife, put it in what they call a marquee reagent test kit, shake it, see if it turned the right color. But of course, I would get heroin on my hands, on my clothes, cross contamination. With fentanyl, you don't want that to happen because if you touch it, if your hands are wet, if you get it in your eyes or your mouth, it can cause an overdose reaction. It can kill officers. We've been lucky; no officers have been killed yet. But fentanyl has changed how officers need to handle and process these narcotics. So this is where Raman spectroscopy comes into play, and basically that's a fancy word for handheld laser that can be used to identify unknown substances without opening the container. So long as the laser can see through the plastic bag, as long as it's not black or dark color, the laser can then do what we call a presumptive analysis and identify over 1,100 different chemicals and precursors, drugs, allowing the officer to safely identify and handle those products. So the evolution in narcochemistry really has forced the evolution in how law enforcement manages and handles this new dangerous threat. My opinion, every drug situation is a hazmat situation.
Yeah, I'm with you there. Hey, Mike Brown, DEA agent, your global director of counter narcotics technology. And I actually want to put a link to that laser in our show notes for our viewers. You are the counter narcotics technology director for Rigaku Analytical Devices. Did I get it close?
That's pretty good. Yeah, you're okay.
All right, Mike. Hey, thanks for your
Yeah.
years of service, your time in the Rangers. Appreciate what you're doing now.
No, absolutely. And your time as well. I understand you were an officer out in California, so thank you for your service.
Yeah, thanks. I appreciate that. Hey, to our listeners, let me know what you think about today's show. Check us out in our show links. Hey, Mike, when are you coming out with your book?
You know what? You'll be the first to know.
Okay. All right. We'll have you back on the show.
Sounds
Check,
good.
check out our links and shoot me an email. Tell me what you think. Policing matters at policeone.com. Policing matters at policeone.com. I want to hear what you have to say. I hope you're doing well, good, and taking good care and being safe. And hope to talk to you again real soon.